All right, welcome, Adrienne. Thank you so much for being on our Spotlight series for the Best in Utah Pelvic Health Edition. I'm super excited to have you on here. I know that our paths crossed way in the beginning when I moved here in Utah, and they've intermingled a lot ever since. So
Yeah,
I'll introduce you here to our audience, and then we'll jump into all the questions to learn more about you.
good.
Awesome. Okay, Adrienne Brown is a certified professional midwife and a licensed direct entry midwife with a passion of transforming maternity care into a more natural, informed, and personal experience. Raised on a farm in rural New York, Adrienne grew up immersed in the rhythms of natural living, which shaped her approach to birth and wellness. After a deeply medicalized experience seeking a midwife for her first home birth in 1995, Adrienne became a birth advocate, founding grassroots organizations and championing informed choices for families. With studies in women's studies, sustainable leadership, and midwifery, Adrienne has attended hundreds of births across the U.S., serving families in both rural and urban communities. Her approach blends modern, evidence-based practices with the intuition and compassion that make birth a transformative experience. Excuse me. As founder of Wasatch Midwifery, Adrienne is committed to creating a space where families feel empowered, supported, and seen through every stage of their journey. Spot on with that for sure.
Yeah.
So welcome,
Yeah.
welcome, welcome. Okay, let's dive in right off the bat. What made you decide to be a midwife? Tell us your story.
So I did come into midwifery care as a consumer
Yeah.
in 1995. So um, I guess the part about highly medicalized experience, I sort of was already on this route of natural living stuff even back then.
Mhm.
And I was young and I first was living in Albuquerque, New Mexico, where I looked literally in the phone book, and younger people won't know this, what the experience of looking in the yellow pages.
Yes.
And I looked under, midwife, boom, and found, and I called this woman, and I was sort of like studying ceramics and living in the desert and all this kind of hippie stuff. And I called her, and she literally pulls up in a VW bus to my home where I had like roommates who were getting their master's degree at the UNM and things like this. And they're like, "Oh, so you're going to have the baby here?" Um, and I had this midwife, and ultimately I moved back to New York State where I'm from before I had the baby. And then that's when I realized midwifery, the legality of this type of midwifery was very different. And I had to go in a health food store and look on the wall to get little business cards. And even then, it was sort of this clandestine. You had to know somebody and talk to somebody because midwifery in the out of hospital sense, midwives who were attending home birth, it was illegal.
Hmm.
Not just illegal, like, oh, you can't get a license or something. It was being prosecuted as a crime. Midwives were getting arrested at this time and sort of rounded up in a modern day witch hunt kind of a thing. So um, I did have the home birth and my little modest apartment floor on a winter day in December after Christmas in 1995. And then I had to get involved very politically. I didn't think, oh, I'm going to be a midwife. Like I read Spiritual Midwifery, the classic book, and I thought, wow, that's pretty cool. Um, yeah, prior to this, I lived a brief stint on a hippie commune myself, so I was like all into that. And it was through my political action work and the grassroots organizations and establishing some of these consumer-based advocacy groups for midwifery early on with people from all over, and to understand now to own a birthing center and a midwifery practice and like take insurance and have all these things is like such a long way, such a 180
Yeah.
from being this like whispers in the back room of a health food store,
Yeah. Yeah.
finding a
What a journey.
midwife. So it's interesting. I've really seen some of this history of this kind. Nowadays people take this kind of thing for granted, but it's sort of like, well, you don't even know. We were just happy to find anybody
Hmm.
and hope we didn't get arrested
Yeah.
back then. And that still exists in some states in this country if you want to have out of hospital birth. So anyway, that's how I got involved. And then I obviously studied different things in college, like Buddhism and the creative process. And I went to a very hippie school in Vermont where you could like, it was fascinating to do whatever you wanted to do, which
Yeah.
was fun. And then years after that, went to midwifery school.
Gotcha.
So
Cool.
anyway,
Very
yeah.
cool. Okay. What do you feel like makes you different in your approach and how you do things? Obviously, you have a lot of experience and life experience through all of that that's shaped you.
Mhm.
What piece of that makes you different in how you're caring for your clients or patients?
Yeah. I mean, I think the breadth of experience that we have that we've created within this practice and my colleagues who help me and my team, but also it's been um, a conglomerate of everything I've been thinking about for more than 25 years.
Yeah.
It's now it's like, yay, I've arrived at this place. I have a very different practice now than I used to have years ago when I would go around to people's living rooms and have tea with them, and it was very intimate.
Mhm.
I'd like to think that we still have that model in the back of our mind, but it's not scalable to what we're doing now. And
Mhm.
that certainly, we have some midwives in our community who that's their style of practice. When I think back to what I used to do as a midwife, it was sort of like, oh, well, if your baby's jaundiced or if you're having breastfeeding stroke, it's like, whoa, I don't do that. I'm just there like catching the baby. Um, so now we have a much more integrative approach. We
Yeah.
have many years of using sort of a functional way of health and promotion. And there's still so many things that I want to do. Sometimes we get caught up in our bread and butter, which is delivering babies. But now, with more staffing and things like that, that I can have the time to create content online that people can refer to when it's 2 in the morning and they're having problems breastfeeding. Um, we can do some more of that to offer more of a social aspect, not to mention we undertook a huge renovation of our space
Yeah.
and
Yeah.
expansion. So now we have the space. It's been a long time coming, so we look forward like soon, as of like next week, to start implementing our next phase of more social interaction in groups to provide. That's always a missing element.
Yes.
So I think the difference of having a big practice, we do all the lab work, we have all the things.
Hmm.
Um, it's tremendous to kind of have everything and everything on board that you could possibly need. But in midwifery, you never know
Yes,
if
you're very
these
true.
things are needed. And a smaller practice or someone who just sort of attends a few births here and there might not have the infrastructure that we do. So
Mhm.
that's where it's important. And that's one thing that we're really good at doing, which is a different style, but know that with the breadth of experience, we mostly just do nothing,
Mhm.
which is great.
Super cool. Super cool. Okay, who would be an ideal fit for you and your practice and your team there? Like, walk us through that.
Well, over many years of understanding about midwifery, um, anyone is an ideal fit. I mean, obviously, medically, there is such a thing that some people will not be appropriate for our care, and we're very clear to let them know. And that's another thing
Hmm.
that we do really well. We have people who we really say, hey, it's not in your best interest to give birth in a birthing center. You need to be in a hospital setting because, hey, of this history, or you have a blood clotting disorder that probably you're going to be fine. However, we need to interface with maternal fetal medicine. We need to bring, we know enough that, and because we do, all the lab work and even, more than most everyone does, we can discover, oh, coincidentally, you have Graves' disease. Like, you need to be under the care of an endocrinologist. You could probably still go on and have a fine childbirth even in the birth center. But, unless we look at this broader approach, we're missing things.
Totally.
Um, and so, outside of medical indications that may not be such a good plan or might just be untenable for someone to birth here in the center, we enjoy the fact that we're a good fit for anyone.
Yeah.
I mean, obviously, certain people come to us. Unfortunately, we don't take Medicaid. We don't. and I've tried a million ways to Sunday about thinking about this,
Yeah.
and it just is in the world of private equity buying up hospitals and cuts to Medicaid, which are coming really badly down the pike, insurance denials, poor reimbursements. There's so many reasons financially, fiscally, that running this kind of business is actually hard. In fact, I'm going to do a little post about this, about birthing centers around the country shutting down, labor and delivery units and hospitals shutting down. So we might be hard pressed as far as maternity care deserts big time because
Yeah.
this is a hard business to run. It
Totally.
really is.
Totally.
We run into it every day. So, but ideally, we care for anyone who wants to be here. Obviously, people have to be a little self-motivated.
Sure.
Maybe it would be coming up with the finances to deliver here, or having insurance coverage that fits. Um, but it's interesting. We have a lot of professionals, older families who are people in their 40s having maybe even their first babies, all down to young families, someone who's 22 years old,
Yeah.
and everybody in between, including, non-traditional family systems. We just meet people where they're at, and it's fun that we get to care for a lot of different people,
Hmm.
even people who think I don't have a high pain tolerance. We're like, let's see about that.
Yeah.
So
Yeah.
I used to think like maybe there's a certain type of person that comes to midwifery care, but we're such a different practice that
Totally.
we get all comers. And I like to say, if you're someone who you're like, I don't know about birthing in the hospital, or I've done a little research, or I don't feel
Yeah.
comfortable, this is a perfect segue
Totally.
uh, for people.
Yeah, absolutely, absolutely. Okay. What does the process look like to work with you? Like, does people just call and schedule on your calendar? Do they have to do interview them? Like, how does it all work?
Yeah, I mean, we just did a new website. We did a rebranding with this renovation. We have a new brand, new website.
Beautiful.
That's
Beautiful.
working fine. We've worked out some glitches with our contact box, but anyway, um, it's important to us that people know. So we do highly encourage people to do a virtual tour,
Hmm.
or an in-person tour
Hmm.
rather than just say, hey, five of my friends have birthed there. I know I want to, maybe they've been here before. We're still like, hey, let's talk about you and let's make sure this is a good fit.
Hmm.
Um, because we want this to be a good fit for people. And
Yep.
we want them to know what they're getting into, and also, again, like be self-motivated
Hmm.
to do this,
Hmm.
which doesn't mean you have to be super into yoga or eating tofu or anything else. Again, we meet people where they're at as far as pregnancy also is a really important time where people are making lifelong health changes, which that's really exciting to me.
Hmm.
So people, we want them to take a tour,
Hmm.
where they can do it virtually
Yeah.
with one of our staff members, kind of on like a Zoom call or
Yeah.
FaceTime or something, just to get their questions answered. We're actually filming today,
Yeah.
like a virtual tour that we will put on the website that people can see it before.
Love that.
We have beautiful photos of the space, but anyway, so they can sign up there.
Hmm.
They can, because we take insurance,
Hmm.
we always do sort of a verification of benefits for
Yes.
people, because this is a laborious process, and unless they're like really going to be our patient and have skin in the game a little bit, we don't do this for everybody. We say, hey, look on your benefits, see if we're in network with your provider. We can tell
Hmm.
you about that. Um, and that's another thing that sets us apart is we actually take insurance.
Hmm.
Many providers say, oh yeah, we take insurance, but what that means is they give you a big receipt and
Yes.
say, submit that and have at it and
You're in
fight the
network.
battles. We actually are in network. Um, and again, we have some people who have zero deductible maternity benefits. They're only paying like 2,000 bucks,
Yeah.
with it's very affordable.
Yeah.
Um,
That's great.
so
Cool, cool. Okay, one of my favorite questions to ask is what is something that most people don't know that you think that they should know, whether that's about you, your services, midwifery, like give us a nugget there.
Well, we always run into time and time again that people can use midwifery care as primary maternity care all the way through. They never really have to see a doctor.
Yeah.
People are still like, "Oh, I thought I only just come here to have the baby." It's like, "No, no, no, we do all of it. We do all the
Yeah.
prenatal care. We are autonomous providers,
Yeah.
and we're licensed and skilled at doing this."
Yes.
Um, you know, always I want people to know that midwifery care is a reasonable, wonderful, safe option if you're healthy and having a low risk pregnancy without extenuating other medical
Yep.
factors like we talked about. Um, I've gotten away from over the years trying to kind of waste my time to tell people why midwifery is safe.
Right. Right. Yep.
I'm more in the business of like, why is this actually safer and a more appropriate option for you
Yeah.
actually to have better outcomes when we're dealing with this sort of maternity healthcare crisis.
Hmm.
And our outcomes are abysmal, 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 like failing
Hmm.
in, if we look at other nations in the world, it's like, wow. Um, anyway, so
Great.
having those conversations and knowing that should be the standard, should be like in Scandinavian countries. I recently traveled to Sweden, Denmark, and in meeting those midwives and seeing what they do and
Yeah.
how many, like they run the show. I mean, they mostly have hospitals. They really don't have a large out of hospital component actually in Sweden and even Denmark.
Yeah.
Um, Netherlands, they do. And I did some time work with some midwives in Amsterdam, but um, they run the show. Like when you get pregnant, you go to a midwife
Yeah.
and you don't, unless you have to go to the doctor. And then it's like, well, why would you have to go to the doctor? Let's break that down.
Yeah.
Versus here, this idea is so foreign that it seems so much going against the grain
Hmm.
and even receiving pushback from your friends and family a little bit. So
Sure.
we're
Hmm.
trying to really change that
Yeah.
narrative. So
Absolutely.
that's what I always want people to know, that
Yeah.
actually this is quite
Yeah.
reasonable.
Yeah.
And
Absolutely.
and but it is finding a good provider and somewhere that you feel safest.
Hmm.
Um,
Absolutely.
yes. And I also want people to know that um, childbirth in pregnancy isn't always safe, okay?
Right.
And this is a really important thing to know. When you've been doing this a long time, you realize sometimes things happen outside of what we would anticipate.
Hmm.
And that's where, when we get into, this free birth movement and all this, it's like, okay, cool, but it doesn't always work out the way, or you have a situation that you didn't know about or
Hmm.
whatever. So there's finding that blend and that balance
Yeah.
um, is key.
Totally. Totally. Yeah.
So
Birth is unpredictable.
yes, yeah,
Okay. Next question I have for you. Is there anything special you want to promote to the audience watching? Obviously, you have your new website and your new
yeah.
wing and things like that. Anything else exciting happening?
Well, like I said, we're trying to focus more on so creating social supports for people. I think the pandemic was really hard,
Hmm.
and being a parent in this time and place in the global, um, sort of geopolitical global reality that we have in the world, it's hard. It's hard for parents, the way we work, the way we um, eat, the way we raise our children, the resources we have at hand are vastly different than we had 10 years ago, 5 years ago, 20 years ago. So
Yeah.
navigating this, we think a lot actually about what we can do better. And one of the things time and time again is, um, yeah, we could do these other things, but what it boils down to is, um, like stress reduction and calming the nervous system. And we have a lot of parents who are way up here and functioning. This is their default mode. And we're like, oh, that's what we need to address.
Yes.
Um, because if we just make this smooth and
Mhm.
calming, people are going to do fine having their babies,
Right.
you know. Um, so anyway, that those are some new things that we want to do as a group. So we're part of making this new physical space within the clinics to have space to do that
Yeah.
was a big deal. And we while we would have loved to have like a big studio and yoga and treatment rooms and all this, we don't quite have that, but we can certainly add more social support, more mindfulness, more stress reduction,
Yeah.
more conversations for
Totally.
people to explore that.
Totally. Totally agree.
Yeah.
Cool. Very cool. Thanks for sharing that. Okay. My last and final question for you is what do you want to be known for?
You know, I had a patient the other day, and she's had a baby with us before. She just had her third baby, and it was a great compliment to me and to what we do here because she said, you know, I come here because I know the way you show up for me and
Hmm.
is consistent. I don't feel judged. And that is important that we are the same, we're the same. And how we might approach an urgent matter or a risk factor or having a hard conversation with someone like,
Hmm.
you know, we have to now send you to the hospital because you have hypertension or you
Yeah.
know, they can know that we will consistently show up
Love that.
in the same way,
Yeah.
whether we have to resuscitate the baby or they're having a medical emergency or everything's just great.
Hmm.
Um, it's so hard in today's world to find anything that is consistent
Hmm.
and people who really show up in the same way.
Love that.
And we actually have to do a lot of work outside here to do that.
Hmm.
And you have to understand most midwives don't make it 3 years.
Wow. Really?
Okay,
I didn't
because
realize that.
they burn out and you know there's a myriad of things, right? Or they're
Yeah.
not charging enough money, it's not tenable.
Yeah.
They become resentful to the profession because they feel all their energy is put out and they, you know, want
Hmm.
to be Mother Teresa, whatever. And
Hmm.
you have to be smart about this and you have to, you know, and have this balance. And we actually take this work really, really seriously.
Hmm.
It's not just like this, you know, for
Yeah.
us.
Yeah.
And that is always the goal, that we are professional in our pursuit of this
Hmm.
and that we're consistent and
Hmm.
that no matter what else is going on, we're right there present.
Steady.
Um, so hey, if we can do that, then
Amazing. I love that.
golden.
That's so great. That's so great. I
Yeah.
love that. Okay. Where can we find you? Website, social media, location, all the things like that so we can direct people to you.
Yeah. We have the fortuitous fortune of being located in this marvelous environment right up in the mountains on Wasatch Boulevard, kind of off of the freeway. It's easy to get here. People actually love to come here. They're like, ah, you know, we're not down in the thick of it. Of
Yep.
you know, it's easy to get here, and it's a very peaceful setting. We
Hmm.
have amazing views of the mountains and everything from our rooms. And that's really important because actually they've done studies on healing, and if people are looking at nature,
Hmm.
it's their healing improves. And
Yep.
that's
Yep. Yep.
again so intentionally of how I designed this space with the art, with the views, with the furnishings,
Yeah.
which were very, very intentional
Yes.
that improve people's well-being and healing. If you look at some of those data, it's interesting. So anyway, but we're located up here. Our website, wasatchmidwifery.com. We're on Instagram at Wasatch Midwife. Have Facebook. Um, and we do have a YouTube channel, which we will be tossing, you know, now
Yes.
that
Yes. Come in.
I can have some time. look, that's one thing. We're going to put a lot of content on there about common questions we get.
Love it.
That I envision people watching a video of how to latch their baby at 2 in the morning, and they can watch a little video that we have.
Yep. Perfect.
Yeah.
Love that. Love that. Well, thank you so much,
Yeah.
Adrienne, for jumping on here, for doing the Spotlight series,
Yeah.
for all that you're doing in the community here in Utah, and even like the patients that we mutually share and
Yeah.
all the things. So thank you so much.
Yeah. Yeah. Thank you.